I'm Niyati Parekh, and I direct the Public Health Nutrition program here at the College of Public Health. My research focuses around chronic diseases. I'm a nutritional epidemiologist by training. I study obesity, diabetes, and risk factors of cancer as they relate to diet and nutrition. We focus on all forms of undernutrition and overnutrition. We also teach about the disconnect between agriculture and good nutrition. We talk about different levels of food policy and determinants of nutrition and food intake. I think food access is a big one. World hunger should never be there given how much food we have. I think this interest comes from when I was a little child and I used to follow my mom around when she didn't have someone to watch me at home. She did a lot of community outreach and she used to take me for immunization camps with her. But the only way kids would actually come to those immunization camps or even come to school is if they were given meals, cookies or small biscuits. I didn't realize how much it impacted me that nutrition became so important, just the connection between food and health. Another great challenge in public health professionals is just not understanding how to interpret and read and integrate the nutrition literature. And the nutrition literature is ever changing. A few years ago, dietary fat was bad and now suddenly sugars are bad. And the common person is confused and even students are confused if they don't know how to access, integrate and understand the literature. So another challenge is nutrition education. We have policy that's in place to prevent certain chronic diseases, but people don't understand those policies. They don't understand what calorie labeling might mean. And sometimes it works the other way where they purchase extra calories or more calories and to get the best bang for the buck. So nutrition education is a huge one as well. Given that we train our students in so many different areas, we have to tailor the program depending on what the student wants. We have nice, small, cozy groups of advisement and mentorship, and I think the students really get a lot of one-on-one time from our faculty. We have various events in which only the public health nutrition students can actually interact, get to know each other, discuss issues that are unique to public health nutrition. A great example I want to give is a cooking challenge where students have to put what they've learned into practice and actually cook up a meal. And so this gives them a chance to interact with each other, to think about a public health challenge and a situation, to apply what they've learned and also to interact with their faculty and peers. A lot of our students have wanted to do global work and have been successful in finding positions abroad. A lot of them are doing nutrition education and food literacy type of work. We've had students that have found employment at the Department of Health and others in food industries. The Public Health Nutrition MPH program at the College of Global Public Health is very unique because not many schools of public health actually offer public health nutrition. I think one of the biggest advantages that we have here is they have the ability to work in close connection with food studies and nutrition folks at the medical school, at Steinhardt. What's unique to the nutrition program is that we also try to do study abroad and we try to tailor this. A lot of colleges don't have these network campuses around the globe. And importantly, we do both global and local work because there are lots of students who are interested close to home, want to study national issues, and we have a combination of both. Because of its location in the heart of the city, I almost think of this as, connections being made from day one, from get-go. World Food Program, I haven't seen anything like this before, where you have professionals who are actually living those lives on the ground in different countries who come to the classroom and they're partnered up with students from the MPH program, and then they work in teams and they come up with challenging situations and a solution and a multi-pronged approach to the challenging situation all in one classroom. The certificate in public health nutrition allows students who want their area of study to be, let's say, epidemiology or socio-behavioral health or health policy as their main track that they're pursuing. But because nutrition is a cross-cutting risk factor and it's really difficult to disentangle nutrition from any of these issues, we also afford them the opportunity to take a public health nutrition certificate in addition, which is rolled into their program, and they have to do just 2 extra courses, and it gives them the core nutrition curriculum and the expertise so that they can combine that along with their field of study. This is also unique because we're going to allow other health health professionals like nursing, dentistry, to do a public health nutrition certification if nutrition is relevant in their fields, whether they're working or studying. So this gives them an edge. NYU and New York City is so broad, and you don't have everything given to you in a basket. So I think the students that have really done well are those who can navigate their way, those who can really connect their experiences, their coursework, their pieces. Students who are fearless and are happy to try different experiences, travel. Public health is not one field, but it's many fields coming together. So I think when these students come together and just combine their experiences, it creates something which is so new and has a completely different perspective. What makes me wake up every morning is the joy and the thrill of interacting with a younger generation and developing something fresh and new with them. And just the energy and the ideas, they keep me young. So I think the passion is two ways, but it's the students. And of course, the fact that we are doing good work at the end of it together.